Okay, Richard, now let's turn to the other side of it, the ones who make it. You know, they reach the mountaintop, they've done the program, and they have reason to be proud. They're cured. What do you want to say to them?
Celebrate. Have a party. Enjoy yourself. You know, many people either feel that way after only 1 month on the incurables or a couple months or whatever. When you feel like you've done a lot of work and you've had a lot of results, maybe you're not even totally well.
You don't even have to wait then.
Take a week off, maybe take 2. Celebrate. Give yourself lots of appreciation.
So that's not going to cause a relapse?
No, and I'm not talking about celebrating. We're not talking about Jack Daniels, you know, and Subway submarine sandwiches here. We're talking about, you know, lighten up a little bit. Have some laughs. Forget some of the routines for a little bit. Don't necessarily go on to bad things, but just forget.
But do something to reward yourself because you worked
yourself.
hard.
You've done some good work. And then it's time to regroup. Pick a period of time, say, hey, for a week I'm going to take it easy. Then regroup and ask yourself a couple questions. First one is, are you well? I mean, what do you feel? Forget what a doctor says.
I mean, take the time not just to celebrate, but reevaluate.
Yeah, reevaluate. And how do you feel? You know, do you feel like you've healed yourself? Do you feel like there's any work left to be done? Ask yourself. You have to empower yourself. And most importantly, do you have any symptoms left? Okay. You may say, well, 80% of the symptoms are gone, but 20% are still there. You need to get rid of that 20%, so after you regroup, it's time to go back and do more work.
And then you'll have more enthusiasm.
Absolutely.
Okay, Richard. Now we come to questions from readers. Now, the biggest one seems to be dosages. We did cover that in the first tapes. It didn't seem to be enough. It's still, they're saying, I don't understand dosage. What do I take?
You know, medicine and pharmaceuticals has done a wonderful job at creating a very ignorant public that they don't even know how to trust their own better judgment anymore. Medicine wants a bunch of sheep that can be led to slaughter. They don't want patients to think for themselves. In fact, if you start asking your doctor questions, that's the first time that you're going to see your doctor get really mad at you.
Okay.
So what's happened is people...
Well, they feel very inadequate.
People don't know how to listen to their inner voice anymore. People don't know how to follow just good judgment and common sense that Dr. Christopher used to talk about. So with dosages, let's start out and make it very simple.
Okay.
1 unit, we could say 3 times a day. That's a good place to start. Now that unit could be 1 capsule of herbs.
Okay.
It could be 1 dropper full or 30 drops of tincture.
So that's a baseline.
It could be a cup of herb tea. It could be a teaspoon or a tablespoonful of herbs. But find yourself a dosage that's a beginning dosage and have 1 of those units 3 times a day. If that isn't working for you, double it. Go up to 2 units 3 times a day, and then 2 units 4 times a day, and 2 units 5 times a day. We're not building a nuclear weapon here. We're using plants of nature. This shouldn't be that difficult. Start with...
I guess they're frightened, Richard, you know?
They're absolutely frightened. And, you know, they're frightened. The main thing I find people are frightened of is overdosage.
Right.
Do you know that in my entire life, I have never met the family or friends of a person that killed themselves using herbs? Never.
And you use more herbs than
and I use
uses.
20 times the dosages at 20 times the strength.
So it would have happened in your clinic.
It would have happened
years.
in my clinic. I've never seen it. I've never met anybody who we could say has hurt themselves or caused any damage or killed themselves with an overdosage. On the other hand, I have met tens of thousands of people who didn't get well because they were pussyfooting around with their herbs and their herbal dosages, and they were afraid to take too much. Your body will tell you when you take too much. And remember what Dr. Christopher said, if you vomit, a cleaner stomach for the next dose.
No, it isn't the worst thing.
A lot worse things can happen going to the hospital, and you'll find out what they are.
Now, in the earlier tapes, we mentioned for children, you know, you said you take, what is it,
we get
adult weight of 150?
Yes, we get a lot of letters about that, about people that want to know, how do I dose my children? And again, I'll say this again, you take the child's weight, say the child weighs 30 pounds, and you put that over 150. What that means is 150 pounds is the metabolic size of a person for a complete adult dose. So even for people listening that are older, that aren't children, if they weigh 100 pounds, they don't weigh what we would call as an adult dose. So even adults that don't weigh 150...
Oh, a lot of women No
sure,
way.
110, 100 pounds, 120 pounds. They might say, well, I'm just sensitive. They're not necessarily sensitive. They're just not the mass of a 150-pound person.
Right.
So anybody less than 150 pounds should put their weight over 150 and back to a child.
Okay, so a woman's 120, let's say.
Yeah, 120 pounds.
Over 150.
That's right. You put that over 150, you reduce
fraction.
that to the smallest fraction, and you use it. If your child weighs 30 pounds, you put 30 over 150, you reduce that down, that would be 1/5 the adult dose. If your child weighs 50 pounds, that would be 1/3 the adult dose. But you put whatever your weight is. Now suppose you weigh 300 pounds. Suppose you have some man that weighs 300 pounds. Put 300 over 150,
That's double.
and you'll find 2 to 1. That person should be taking 4 units 3 times a day to get maybe their effective dose. But it's based on mass. Forget age. The safest way for children, for adults, for anybody, is based on that 150-pound range.
Okay, Richard, you explained it for children. Now, what about pets? I know myself, we got a little Scotty named Susie. You've met her.
Yeah.
And we had to have her spayed. So she's gaining weight, even though she isn't eating that much. And we don't really know what to do. We don't want to starve her, but we don't want her to be a pig. Could we give her some of your female formula, and how much?
Definitely.
To restore those hormones?
And you know, this is not an isolated question. We get thousands of letters of people that say, hey, I love my dog more than my husband or my wife or whatever. I want to know how to fix my animal. Forget the person I live with. And this is very serious. The first thing we need to let people know is that you can use all the same formulas you use on yourself on your pets. The main thing, again, is you have to take into consideration that some pets are very small. Some pets
so
might be
like
very big.
18, 20 pounds.
Yeah, at 20 pounds, you put 20 over 150, and that'll give you your dosage. And the dosages for small dogs is going to be down to 1/10 or 1/9 or 1/8 of what the adult dose is. So you're using a few drops, but it'll be very effective. Animals respond wonderfully. I've had for years.
Really sick pets get better?
Patients would walk into my office. It seems to be the major final treatment that veterinarians use for animals is they kill them. Because all my patients would walk to my office with their cat or their dog, and I'd say, what did the vet say? And the vet said, well, it looks like he's in pain. We better put him down. And I would look at the animal and look like, it doesn't look in pain. And I hope that when I get a little
we don't put you down.
Yeah, when I get older and I have a little bit of a limp, I hope the person doesn't go, well, let's put old Dr. Schultze down here. It's a horrible thing. That seems to be the final treatment for animals. And I've had 95% of those animals recover and get well after the veterinarian said kill them, using herbs and natural treatments.
You just squirt things in their food.
That's right. And people will call in and they'll say, but wait a minute, I got a horse with colic. Now my horse weighs 2,000 pounds or 1,500 pounds. Use the intestinal formula #1 and use 10 times. Put 1,500 over 150.
You just use that rule.
Use that rule with every animal, and you will be able to treat that animal. And herbs and natural healing programs work wonderful for animals. And again, we get hundreds of letters on this, so I'm glad you brought it up.
Richard, another area of fear and needless confusion is when to take herbs. Now, you just covered dosages real nicely, but what about timing?
We need to keep it simple, too. People, we have hundreds of letters, stacks of letters. Do I take the herbs before my meal, during my meal, after my meal, between meals? I mean, it's endless. Again, people have to empower themselves to be a little bit more of their own doctor again.
What do they think?
Yeah, what we need to do is spread the herbs out. That's a guaranteed. You know, if you're taking 1 unit of herbs, like we talked about, 3 times a day, morning, noon, and night, I mean, spread it out during your day. And if you feel that the herbs maybe there's a lot of cayenne in them and they burn a little bit on an empty stomach, then take them with a little
food.
food.
You shouldn't need a book to tell you that.
You don't need a book to tell you that. People, again, have been so shackled by medicine and pharmaceuticals where a doctor was like, oh, don't you make it, how would you know? I spent 23 years in medical school and you're a stupid, ignorant person. Don't you dare make a move on your own without asking me. What I'm telling people is they know a lot. My patients knew more what was wrong with them than I did. How could I know? I'm not them. I used to sit and ask my patients what's wrong with them, and they'd say, I don't know. That's why I came to see you. And I go, well, you tell me. You're the one sitting in that body. I mean, and we would go back and forth. People who are watching this video are the best people to empower themselves. Take the herbs at different times. See how you feel. See how you react.
Well, their questions show how unsure of themselves they are.
That's right. And the bigger issue here that we're really dealing with is people need to strengthen themselves up, empower themselves, and realize, hey, these are gifts of nature, and if I do it wrong, I'll feel what I'm doing wrong.
You know, Richard, I've found myself that the more you try to answer it yourself, the better you get at answering it, the more you trust yourself.
Absolutely.
And the less scared you are.
And that's what a big part of this is, Sam, is people will learn, they will empower themselves to make
They'll
these
hear
decisions.
a voice or just a feeling will say,
That's
you
right.
don't need it now.
And some of these readers say, hey, God told me. Other readers say, I listened to my little voice or my inner voice.
Right.
Whatever it is, they know better than anybody what is going on in their body. They need to start listening to themselves and take the herbs, you know, at different times and see how you react to that.
Now here's a story that happened to Sandy and I, where she's taking your female formula, still having some hot flushes at night, but she's, like I said, she's taking the whole thing in the morning, and you told us that it was just so obvious if we would have thought it through, spread it out, and you said take a dose before bedtime. That's something people can do. And once she had a little hot flush or something in the middle of the night, you said, here, give her some of the tincture in the middle of the night.
Sure, and if you're taking your basic dosage, 1 dropper full, say 3 times a day, but most of the problems you have are in the evening, then take extra dosages in the evening, or don't start taking the formula till early afternoon.
Okay.
Use it to when you experience the problem. That just makes great sense.
Okay.
You know, for most of us, it's a lot of effort to remember how to think, because so much of our free thought has been destroyed by the public school system or our parents or society and culture. And so what we're telling people is, hey, think for yourself. You're a powerful person. Look at what's happening and make good, common sense, rational decisions. I think when they start
doing it, they'll find it pleasurable.
Yes, absolutely. Okay? And they'll begin to feel strength that no one can give you, that they've never had before, about making their own decisions. And that'll be part of their healing process too.
That's right. Now, another question we've had, Richard, is, and they get real scared on this, is, you know, the poultice that pulls out tumors, because I've got, remember, a couple letters where they just freaked. One man said it got bigger, it started discharging, it looked real ugly. I had to rush to the hospital. This thing was making me worse.
Remember one thing about poultices, and we've talked about a couple major ones, and we've even showed how to make them. Black poultices, real drawing poultices, and we've also talked about other types of poultices that you can put on your body to draw things out. We've made them. Remember that when you're talking about doing a poultice or even a garlic application, you are now doing a surgical procedure to your body.
What do you mean surgical?
In
Not
other
using
words,
a knife.
No, but it's an herbal knife. Believe me. We have, remember, we have the pictures and the jars with the tumors at my office. You will pull things out of your body.
So when you met that guy from Florida pull things out, I knew you didn't meant, but I want to make sure they knew.
We're meaning
he didn't. This wasn't psychic surgery.
No. We're talking about silver dollar-sized tumors.
They kind of float to the top. You mean the skin breaks open?
The skin breaks open, blood comes out, pus comes out, lymphatic fluid comes out.
So it's not that they're getting
You're
worse.
in extreme pain.
You know what I mean? Or they got infected from the herbs.
No. So people have to remember, because all these people clear up and they end up having a tremendous healing and they get rid of their cancer or their tumors or whatever. But this is not for the lighthearted.
It does scare them, Richard.
If you are afraid of blood or pus, then I suggest to go to the hospital and get put under and have a surgery. This aspect of natural healing is only for the brave. And if you feel you're a little lighthearted on this issue, make sure you have some friends around you that aren't going to faint at the first sign of blood or pus. And I also
tell them that it could happen.
Yeah, and I also mentioned this on the first tape. It smells too. So make sure you have a lot of things like sage to burn in your house and incense and essential oils, because we're talking about some of the most extreme practices of natural healing and herbology. How to do surgery on your body and remove malignant tumors using herbs. When you're in the process of this, many people go, uh-oh, I didn't realize this is what Sam Beiser and Dr. Schulze were talking about.
This is heavy stuff.
This hurts. I'm bleeding. There's pus. There's blood. That's exactly what we're talking about. But all I can say to these people is continue on, because at a certain point, It'll all come out, your skin will heal up, and you'll be better. Use your good common sense, take some deep breaths, don't forget your humor.
So don't go wild and stop everything.
That's right. Don't stop everything. It's okay. Believe me, no matter what a person's experiencing that they think is horrible, I've seen worse in the clinic.
One area I've got a lot of complaints on, and they just get real angry and they get hurt, is they say, Dr. Schultze learned from Dr. Christopher, and yet he doesn't recommend his teacher's formula. What is wrong with this man? What is wrong with you? Are you ungrateful? What is going on?
I'm so rude. I'm inconsiderate. I'm spitting on his grave.
Right.
I mean,
what kind of man are you not to
I've heard it from
push
many
the formulas
people.
of your teacher?
Let's remember a couple things. First off, a lot of people do not realize that Dr. Christopher died. He passed away over 12 years ago.
Right.
And even 12 years ago, he was telling stories about healings that he experienced in his clinic 10, 15, 20 years before that. So a lot of the Dr. Christopher information that we have can be 20, 25, 30 years old or longer.
But wait a minute. Most people will say, so what? What's wrong with that?
And there's nothing wrong with that. The principles and the foundations of what Dr. Christopher talked about as far as natural healing were great. And a lot of the herbal formulas still work today, but a lot of them need to be updated and upgraded.
Why?
And some of the formulas need
Why
to
do they
even
need
be
to be
changed.
upgraded?
There's a lot of reasons. Things are very different now than they were 30, 35 years ago, or even 20 years ago. 20 years ago, there was not a junk food restaurant on any street corner, and now we have one.
We didn't have AIDS.
Oh, we have them on every street corner now, junk food restaurants. Hard drive wasn't even a word that existed 20 years ago. In the last 2 decades, we've seen dramatic change. People exercise less. They eat higher, refined, more fatty food programs. We're probably under more stress now in the middle of the 1990s than ever before
So
in
what you're
history.
saying is you got to upgrade.
We can't expect to
programs.
take the same herbal formulas and have them work for us the same way. Or sometimes it's not the formula, it's just the dosage and the intensity of the routine. Also, since Dr. Christopher's passing, most people that represent him or his routines have weakened his routines.
Why would they do that?
Well, they think, oh gosh, he's not around to defend himself. I mean, Dr. Christopher, you knew the doc.
Oh, yeah.
He was a very intense natural healer,
Right.
okay? And he did not bend. That's one thing I learned from the doc when I was around him. He did not bend on these programs. I mean, listen to this. A cleaner dosage for the next cup when you vomit. Or
In other words, vomiting is cool.
Yeah, or you'd say, well, how do I know when I had enough? And the doc would say, well, tip your head, and if the herb tea doesn't pour out your ear, have another cup. These may sound cute, but this is a very intense natural healer. But I have found that most of the people around that quote Dr. Christopher now are afraid of his intensity of 10 or 20 or 30 years ago.
So they're normalizing him into a wellness
They've taken
herbalist.
the herbs out of his formula. They've taken parts of the routines and thrown them away. And on the other hand, you have one person here, one of his students, that's intensifying and updating his routines. You know,
So you're going the other way.
if Dr. Christopher were alive today,
Right.
don't you think that he'd be changing his formulas? He'd be alive. You know, I hope that when I die, my students don't carve everything I said in granite
And say
and then
Schultze
sit around
said,
and bow to it.
Yeah.
I hope that my students take everything I've done and run with it, upgrade it, intensify it, modernize it, make it work better, work it in the clinic and see what happens.
Right.
When I studied with Dr. Christopher, he hadn't been in the clinic in years, and now it's been over 20 years since he was in the clinic. I've been in the clinic last year. I know what it's like. I travel around and meet these people. You learn what works, you have to do it. So again, it's very important. You know, I look in the health food store today, and I look at a lot of the herbal products there. When I first started trying to clean my bowel, I used Arnold Ehret's Inner Clean. We've all heard of the mucusless diet.
Oh, sure have.
Arnold Ehret was born in 1862. He made herbal formulas for Wyatt Earp and Buffalo Bill. That stuff isn't going to work for us anymore. This is not disrespect for our teachers of the past, but come on, I don't care. I told this, and I've said it many times. I am not out to win a popularity contest. I don't care who complains about me and who doesn't like me. I have one goal, that's helping people get well.
Well, I think that ought to help people understand where you're coming from.
Absolutely.
Okay. Richard, the last thing I guess I want to leave these people with, because you won't be there, okay, for them to talk to like you were for me to talk to all year, is don't sell natural healing short. A lot of people who are strong advocates of natural healing still put a cap on it. You know, like they put the glass ceiling in women in corporate world. Well, they kind of have a glass ceiling for natural healing, that it will work only if your condition is not that bad. But when it hits this ceiling, then it's medical all the way.
Yeah, that's right.
So let's address that.
People think
they're selling it short.
Anybody that thinks there's limits, at least remember me. Remember the stories about my heart. I had valves that wouldn't work, that the doctors said were deformed and could never fix themselves. I got new valves in my heart. I burnt the skin off of this hand down to the bone, to where the doctor wanted to sew my rear end onto my hand. He said I'd never grow skin again.
So you should have had just a cloth.
That's right. I didn't even talk about my knee, that I ripped out all the ligaments in my knee, and the doctor, I think his name was Dr. Frankenstein, wanted to sew ligaments out of cadavers into my knee. He said that was the only way. He said I'd never walk again. This was one of the top orthopedic doctors in Los Angeles. I'm walking, I'm tap dancing. I mean, if people remember anything, remember my stories and the stories of my thousands of patients that healed themselves from the most horrible, degenerative, and incurable diseases anybody's ever seen or known.
What happened to them wasn't supposed to happen.
No, not at all. We broke all the boundaries of science and medicine. One thing that I think is very important for people to remember: medical diagnosis and prognosis. You know, we have books out there. We have the Merck Manual, which is based on, here's all the diseases that people can have, and here's the prognosis or the outcome that these people can expect. Right. I call this the faulty mathematics of medicine. What people need to remember is what is in between there of people getting diseases and their ability to heal is the average American. The average American who's eating 200 donuts a year.
So in other words, all the prognoses are based
on sick people,
on the
average American who's too stressed out, a cholesterol level of 200, hardly has a bowel movement, and when they do, it's once a week. You know, eats that horrible food program, pumping mud through their body, thinking negative thoughts. So
somebody you got 6 months to live, it's based on that guy.
And they have 6 months to live, and if you're going to live that unhealthy lifestyle, you better go out and buy the Merck Manual, because it's going to tell your future. On the other hand, if you're willing to take responsibility for your health, step outside of that average horrible American and become a different person with a different lifestyle and a healthy lifestyle, throw that book away. It's the biggest book of lies ever printed in the world. It just tells you nothing that will apply to you. And what book should you get? There aren't any. These tapes are it. There's nothing ever written about what you can expect, what healing that your body can do if you're willing to take better care of yourself.
But even me, I find out, I believe your stories. I've talked to these patients who've cured themselves. I've seen their test reports. Even me, I say to myself, that's too much. Like you had that case in England. The man was... Tell us about that. You know, I never expected that could happen from natural healing, and I believed in what you're telling me.
I was in Dublin, Ireland, and I was teaching at Trinity Medical College over there, which is one of the most impressive medical colleges in Europe. As soon as I arrived in England, one of our students got into a horrible car accident. At 40 miles an hour, he drove his little midget sports car into the front end of a Range Rover, and I think anybody knows what that means. The Range Rover had a dent, and the midget sports car was a crumple of steel. They had to extract him out of it with the jaws of life, and he said, I don't want to go to the hospital, and they brought him directly to the clinic and to the school.
Because most people would say that's insane.
Broken ribs, fractured bones. I mean, this person was in horrible shape. In fact, the whole top of his knee was ripped off, so to the point where I could see his patella. His kneecap was just floating around in there. He had a hole in his leg. And we had nurses there, and we had many students of natural healing. We put them back together. The nurse told me that she had never seen anything like this in all her years in the hospital.
What did you do, basically, without getting into heavy detail?
We put them back together. We closed the wound. We used herbal poultices. We used our tinctures. Everything we've talked about in these tapes.
And it worked.
Yeah. What doesn't work is people who are afraid to try. She told me that he healed better. That man healed better than anybody she had seen in the hospital in 20 years of emergency work. And I said, why do you think that is? And she goes, I think what the doctors do goes so much against the body that you gave him a chance. We had that wound healed in 24 hours. It was closed. It never opened again. And this person...
That is pretty...
Yeah. And I've seen it again and again. People with head injuries in the hospital. I've gone into the hospital to treat people with head injuries that were scheduled to have their heads carved into. And in 24 hours, using simple herbs like garlic and cayenne, we had the pressure down, we had them
Wait a minute,
well.
they were ready to cut for what reason?
Had injury, had trauma where the brain was swelling.
Richard, why would they want to, in a head injury, just for me, for our readers, why do they want to go in and make those cuts?
Sure.
What's going on?
There was bleeding in the brain, and so you have swelling of fluids in the brain, and there gets so much pressure. Many times the only way to relieve the pressure beyond drug therapy is to actually go
You got to mechanically go in.
Mechanically go in. And this person was an older person that had extreme bleeding in his brain and swelling. And I suggested, because the family was...
What do you mean you suggested? Were you in the hospital?
Well, yes, I went to the hospital. The family demanded that I go to the hospital and meet with the surgical team, the physical therapist, the neurological team.
So you were really in on this?
Oh, absolutely. In fact, in my final 10 years of my practice, most families felt so strongly about having me involved, they wanted me to be the #1 physician in care of these people. And so
the doctors put up with that?
Oh, I stormed my way into so many hospitals, and after they saw me 1 or 2 times and saw the results that they were getting, they were definitely willing to give it a try.
So, I mean, you were in on the consults?
Oh,
and
absolutely. And
they
wanted to immediately go in, and the family said, you know, we felt that drilling into his brain would cause such a disruption in his life and be so traumatic that it might do more harm than good. I mean, we have an 80-year-old man here.
True.
And I said, look, we can use herbs that will reduce his blood pressure and stop the bleeding. And the doctor said, like what? And I said, garlic. And he looked at me and he goes, you know, my mother in the Philippines used garlic, and it took her blood pressure down to nothing, down to normal. And I said, yeah, garlic is famous for that. And another doctor said, well, what about bleeding? And I said, cayenne pepper. You don't have a better herb than cayenne pepper to stop bleeding, even internal bleeding. And one of the nurses said, you know, I've heard about that, and we had a patient in here that stopped massive hemorrhaging using cayenne pepper. And the next thing you know is they were all agreeing with me. We followed the process.
And they went ahead with you.
24 hours, there was no need for surgery anymore. His internal bleeding had stopped.
What did they say to you when this result occurred?
They said, good job, and we went on. But I've established credibility in many hospitals that way, and now I go in and, you know, meet with the other doctors, and we decide what to do for the patients. Remember, it's the patient's right to decide what therapy they want to get involved in.
So I think this is back to our point. Don't sell it short.
Don't sell
Not just the
natural
doctors
healing
sell it short, the customers sell it short.
Absolutely.
And it's so obvious that they sell it short by the way they call my office and ask questions that they do. And we've been hit right from the beginning, Richard, with, you didn't cover chronic fatigue syndrome. Oh my God, there's only a page on ALS. You know, I want a refund. This is all useless. Right?
There's not enough on Parkinson's disease.
Or I
got
1,000
letters.
Disease name, and you and Schultz didn't cover that.
And do you notice that every month doctors come up with a new name for a disease? I mean, we can't possibly update. But these people have missed the entire point
all these
of everything I've said, of every videotape, if they ask that question. The whole basic principle and foundation of natural healing is not treating a disease. It's creating a lifestyle that is so conducive of health with your food program and your cleansing and your elimination programs and your exercise and your emotional programs that's so conducive of health that your body will heal itself. We're not attacking disease. We're not killing disease. That's what doctors do. And the diseases out there today, the doctors can't even do that. They're rampant. Diseases are out of control. Doctors aren't able to fix you. We're not trying to kill or cure disease.
So they don't need the name of the disease up in lights.
They don't need the specifics.
Okay.
Most of the people who followed these programs didn't do any specifics for their diseases. They just got well. You know, I've always said it's very simple to get well. You stop doing the things that you did that made you ill in the first place, and you begin new healthy programs.
And you know, Richard, if you actually did give them, like, you know, let's say they want chronic fatigue syndrome, if you had an herbal formula for that, you would be hurting, because what they would do, they would take that one formula and forget everything else on the tapes.
And their chronic fatigue might go away, and it'll be back right in their face again, because they didn't solve the underlying problems, which were all those basics we talked about in natural healing.
Well, this comes back to that man who, when you had your clinic, you know, you diagnosed him, and he says to you, he goes, I got a rash in my arm. And you go and you examine him and all, and you say, no, you don't. I think you're going to have cancer. And he says, no, that's all I want to treat. I'm not interested in anything else. So it didn't work, and you got rid of him as a patient.
That's right.
You close down your clinic, and then he comes by one day, finds you're no longer there, and the guy's just in tears, because guess what? He's got cancer now.
Yeah, no surprise. You know, Most of my patients that came to me because they had been to everybody else and they had treated all their problems, just that problem.
The way our readers want to treat them,
even
right?
with natural healing and with herbs and with medication. They've tried every way across the
Except
board,
this total
from
approach.
acupuncture to chemotherapy, to treat that problem. But none of them had set up a lifestyle to heal themselves. And that's what these tapes are all about.
I guess what I want the readers to get out of these tapes is to start thinking with these principles. You know, it's like you take French when you're in high school and you know some phrases, but you can't think in French. You go there and you got to look in a book. You don't know anything. Well, it's the same with herbs. They're now looking at page so-and-so of the manual, tape 7 or something like that. They want to just do what you said, but there's no thinking.
That's right. They have to create in their mind what I call a software program of natural healing, to where anybody that walks up to them and says, here's something good for your pancreas. It's the dried pancreas of a cow.
Right.
And they hold it in their hand and they have to think, is this really good for me? Does this make sense, or is this voodoo?
Right.
We want our readers to begin to think for themselves.
Right.
This is what this is all about.
It's not even to follow every little nitpicking thing.
No, it's to empower themselves to create their own healing program, to get well, and then create a lifestyle that's going to keep them healthy and well for years to come. Yeah, make this a part of their life.
That's great.